Good afternoon, everyone, and a warm welcome to our webinar today, which is organized by the Health and Environment Alliance, HEAL, and is titled Endocrine Disruptors and Women's Health. My name is Juliana Angelova, and I'm the EU Research Projects Coordinator here at HEAL. And for those of us who may not be familiar with our work, HEAL is an alliance of over 80 member organizations from the health community in Europe and beyond, working for better health through a healthier environment. Our webinar today focuses on the impact of endocrine disrupting chemicals, or EDCs, and on their impact on female reproductive health, and will showcase findings from FREIA, an EU-funded research project in which HEAL is a partner. FREIA is dedicated to advancing research methods, to identify endocrine disrupting chemicals that are toxic to women's health. This project is a collaboration between 11 institutes from 7 European countries and the USA. EDCs are synthetic chemicals which interfere with our body's hormonal systems and are linked to various types of cancer, diabetes, developmental disorders, and reproductive health issues. Examples of EDCs include numerous pesticides, phthalates, and per- and polyfluoroalkyl substances, or PFAS. EDCs are pervasive, they're found in everyday products, and place a substantial health and economic burden on Europe, with health-related costs from known EDCs estimated at 163 billion euros annually as of 2016, a figure likely far lower than their true cost. And HEAL uses this type of evidence to advocate for improving regulation and the phasing out of known and suspected EDCs, including PFAS. By preventing and reducing exposure to EDCs, we can help to prevent disease. So today we're very pleased to have two speakers from the FREIA project joining us, Professor Dr. Majorie van Duursen and Dr. Virissa Lenters. Majorie is a professor of environmental health and toxicology at the Amsterdam Institute for Life and Environment from VU Amsterdam, and she was the FREIA project coordinator. She will talk about the main findings regarding EDCs and female reproductive toxicity and ways forward. Our second speaker, Virissa, is an assistant professor of environmental epidemiology, also at VU Amsterdam, and she is the main author of a health promotion strategy report produced during the report. In her talk, she will address the main findings of the project team's survey on awareness and risk perception of EDCs among people of reproductive age and actionable recommendations on how to increase awareness, reduce exposure to chemicals and EDCs, and improve health. So before we start, just some final practical tips and information just ahead of our panelists. This webinar is being recorded today and will last for about an hour, with some time dedicated to questions after the presentations. We will disable the chat function during the presentations, and you can write your questions in the Q&A section that you see below your screen. So with that, I'm happy to hand the floor over to Majorie.
Hello, everyone. Thank you, Juliana, for this great introduction and for giving us the opportunity to talk about our results from our FREIA project. So I will be talking about the outcomes of the project. I've had the pleasure to be the coordinator of this project over the past 5 years, and we have recently wrapped up the work, but of course we are not done. But I'm happy to tell you a little bit about what we have done. So when we talk about endocrine disruptors, as Juliana already said, these are the chemicals that disrupt your hormone system, and we are encountering a lot of chemicals and chemical exposures during our daily life. And one of the issues there is not only that the production of it has increased over the past years, but also that many of these chemicals that are on the global market are not tested very well for their safety. And this is especially true for the endocrine disrupting properties. So already in 2017, there has been a workshop organized by the European Commission setting priorities, which health domains are not covered properly in the current regulatory toxicological risk assessment and hazard assessment, and which require test development and how to better identify endocrine disrupting chemicals. So one of these priorities that was identified was also female reproduction. So that is how the FREIA project came about. So the FREIA project started in January 2019, and we had three major objectives formulated in our project proposal. One was to gain new understandings and insights into the adverse effects of endocrine disruption on women's health. The second one, to develop new test methods and improve existing ones to detect EDCs toxic to female reproduction. And the last one is to promote sustainable options for a healthy society and improve women's health. And I will be briefly discuss the first two, and the last one, promote sustainable options, will be discussed by Virissa after me. So what are we dealing with? When we talk about female reproduction, it's a wide variety of disorders and diseases, and some of these are mentioned here. But what you hear very often is that 1 in 6 couples face fertility problems. And not only that, of all these fertility issues, in 1 out of 4 instances, ovulation disorders are responsible for that. So that's also why we decided with the FREIA project to focus mostly on the ovary. The thing with chemical exposure is that the disease originates usually already very early in development, when the systems and the organs and the hormone systems are being produced, and where the function is being more or less imprinted. And the critical periods of sensitivity are definitely based on developmental stages. So early life is really considered to be a very sensitive period for exposure to endocrine disrupting chemicals and the effects it may have, simply because it has a different biology, and there all the imprinting takes place. So this is also what we considered in our project. The thing is that there was very limited understanding of female reproductive disorders when we started this, and I hope that we have contributed a little bit to our understanding of this. But also, our project provided the unique opportunity to use human ovaries from fetal to adult age. So that really allowed us to look at the effects in the human ovary across life stages. And what we did is we compared these findings in the human ovaries also to cell cultures and to rodent studies, to have a better grasp also on how to implement this in regulatory toxicities testing. So as I said, biology really changes. So the fetal ovary here on the left is really where the germ cells are. Then the follicle starts to develop into infancy and adulthood. And after puberty, every month, 1 follicle matures and ovulation can take place, and a body can prepare for fertilization and implantation of an embryo. So what we found in our studies is that EDCs can target the production of steroid hormone in ovaries at all ages. Not only that, particularly the ovarian germ cells were really susceptible for the effects of EDCs. They cause changes in hormones and also cell death, which may lead also to fewer oocytes at birth. And as a woman, the oocytes at birth is what you have to deal with. You do not generate more oocytes along a lifespan. So fewer oocytes is really problematic when it comes to fertility. Next to that, what we saw is that ovarian cell types changes with age, and that the store of eggs is not dormant, as is often believed. And that puberty is a very sensitive period also for exposure to these chemicals, but also that the onset of puberty may change depending on the exposure to EDCs. So definitely a whole lifespan of sensitive periods, more or less. So we also looked into the follicular fluid. That's the biological fluid surrounding the developing oocyte in adult women who were undergoing fertility treatment. And what we measured in these follicular fluid were a mixture of endocrine disrupting chemicals. And this mixture of chemicals, so more chemicals was associated with a less responsiveness to hormonal treatment in these women. And this was particularly true for some of the phthalates. Also, if we looked at biological markers, we found increased inflammation markers, for example. So all of this together suggests the association between exposure to endocrine disrupting chemicals and fertility issues. So clearly this increased our understanding of how the human ovary responds to endocrine disrupting chemicals and what kind of biological effects can occur when these ovaries at different stages, different ages are exposed to these chemicals. So what we did is we created this insight, and we also tried to describe that in a very structured manner called an adverse outcome pathway that really gives a sequence of biological events that leads to female reproductive toxicity. So we published a few of these. These were based on general understanding of the female reproductive tract and tract development, but also implementing the knowledge that we have generated. And this can be used to create a better understanding of what's happening in the female ovary, but also as a starting point for a testing strategy and identify endocrine disrupting chemicals. So what we focused on when we looked at improving test method was we had different approaches. So we looked at computer models. We developed computer models to predict molecular targets. We looked into in vitro, so cell-based assays to study the effects on the ovary, on the eggs, and on early embryo development. We looked in vivo studies to provide more sensitive endpoints, because what we also found is that the endpoints that are currently used in regulatory toxicity testing are not sensitive to pick up an effect on female reproduction. So we looked into more sensitive endpoints and methods to improve toxicity testing and to better capture female reproductive effects in existing animal models. Altogether, all these combinations of assays and methods that we applied led to various biomarkers, so biological changes that can be used to detect an effect of an endocrine disrupting chemical. We looked at cell maps throughout life. We looked at steroid hormone profiles at different life stages. And also we provided these adverse outcomes pathways I just explained. So all of this may help to better explain the effects of EDCs or chemicals that when observed in certain tests, and may help explain what's going on and to identify endocrine disrupting chemicals. So to provide a little bit more detail, but not to overflow you a little bit. So some of these QSARs have, these computational models are published in the Danish toolbox. And some of these assays and biomarkers have been published in the scientific literature, which you can find also on our website. And some of these assays are currently also on the OECD work plan. So that's an international organization used to where they standardized test methods and to develop test methods so they can be used also for regulatory testing. And two of these methods that we have been working on within the FREIA project are the steroid hormone formation assay, the H295R. We're currently doing a test with multiple laboratories testing many chemicals and to see how that performs if we expand, except for looking only at testosterone and estradiol, to a whole network of steroid hormones. And the other endpoint that we are, that's on the OECD work plan is a mammary gland development. There we are investigating if the mammary gland is suitable to be implemented also in toxicity testing. We know that it's a very sensitive organ and that you can readily pick up exposure to endocrine disrupting chemicals by looking at mammary gland development. So that's what's ongoing at international level for two of our assays and endpoints. So to ensure that what we have done also applies and is implemented in regulatory toxicity testing, which was eventually also the reason why this project came about, we described our findings in line with current practice in ED identification in Europe. And for that, we used the guidance that's by the European agency, as drafted by the European agencies, how to identify endocrine disrupting chemicals, and that follows a whole flow chart. I will not go into that, But what we've done, we've added our female-specific findings into this flowchart, saying, okay, at this point, you can look at these test guidelines, and this information will provide you data on female-specific endpoints. And this applies to several regulatory frameworks in Europe. But if you are looking at chemicals for which there's limited data available, then a different strategy may be needed. But I will not go into that more deep. So as I said, our work is not done, of course. So we have recently started, or in January, we started the follow-up project, more or less, or the Berlin project, where we will look more into how these test methods together can provide information on the identification of endocrine disrupting chemicals. So that goes beyond female reproduction. But here we combine several adverse outcome pathways and look how each assay can contribute to identification of endocrine disrupting chemicals. So you will hear more about this project in the years to come. So FREIA focused on female reproductive toxicity, but in the whole call of the EU call for these projects for better test methods, there were 8 projects granted. And they focus on different health domains, including thyroid hormone disruption, metabolic diseases, and also developmental neurotoxicity. And together we have generated over 100 test methods and endpoints that can be used to improve ED identification in regulatory frameworks. Though these test methods are at various stages of development, and several are really at the scientific experimental stage, and some other are more advanced and also at level of the OECD for test method guidance development. But still, most of these still require further development. But you can look at this methods table that's being published for an overview of the assays, and also find other domains and contact persons to contact about these specific assays. We also published a policy brief where we explained what we found were the hurdles for test method development, but also the achievements that we all made on how to improve regulatory endocrine disrupting chemical assessment and identification. So both of these links to these methods table and the policy brief can be found on the Orion website, but also on our FREIA website. So this was really, in a nutshell, all the work that we've done over the past years. So we made a summary infographic on our achievement on improved knowledge. So we found that ovarian cell types and hormone profiles change from fetal to adult life. Endocrine disrupting chemicals can harm the function of ovaries at all ages, and endocrine disrupting chemicals can be found inside the ovaries and are linked to reduced fertility. So we have provided also support for EDC identification when it comes to female reproductive toxicity in the form of computer models, but also cell-based assays, endpoints in existing vivo studies, and biomarkers. And as I said, Virissa will talk more about the recommendations to protect health. So please go to our website where you can find this infographic, and also there are webinar recordings giving more science background on what we have done, but also scientific papers. We have fact sheets and infographics in describing what we have done and our findings, and also more background on female reproductive toxicity, and also the report on the health strategy. So more papers will come out, more webinar recordings will be added, so please be sure to check in every now and then on our website to see where we are and what we have done. So with that, I would like to thank especially all our partners in the FREIA project from Europe and also from the US, who have done all of this work, especially the PhD students and the postdocs and the technicians who really did the hands-on work in the lab and the desktop work. And I'd like to thank HEAL also for their support in the dissemination part of our project. So thank you.
Great. Thank you so much, Majorie, for this very good overview. in speed time that you did of the project, and really showcasing some of the test methods that you developed and that you reviewed, how important it is to be able to link impacts of EDCs to different reproductive disorders, female reproductive health disorders, and of course, the importance of how that feeds into current and future regulatory work and guidelines. Just before I hand over the floor to Virissa, just want to remind all our participants and attendees today, if you do have a question, to type it into the chat box. So there's a Q&A at the bottom. You can type that in directly, and I'm happy to let Virissa take over.
Thanks. 1 minute. I think I am sharing my, yeah, thanks. So I'm happy to talk to you today about a report that we published.
Oh,
sorry. Do we have the right display, and can everyone?
So we see your face, Virissa, which is great, but I can't seem to see your slides. So
Sorry
maybe
about
we
that.
could give it another try.
Yeah.
Or remove the spotlight. There we go. Okay, excellent. Now it's there.
Thank you. So I'm happy to talk to you today about this report that we published back in June for the FREIA project. And in this, we summarize the evidence for effective ways to reduce exposure to EDCs. We summarize surveys on perceptions and knowledge about EDCs around the world. And then we also talk about a survey we did in the Netherlands, which I'll focus on a lot today. And then finally, I'd like to present some recommendations we have about how we can protect women and the broader public from EDCs during critical and sensitive time windows. So there have been quite a growing number of studies on how we can reduce exposures. We have lots of studies on determinants of exposure, but the strongest evidence is from these intervention studies where a group of participants agreed to make changes in their habits or their consumption patterns. And we found 25 studies that had at least 30 participants and up to 268. And most of these studies involved food packaging, changes to food packaging, reducing the use of canned goods or plastic containers. And some of them involved replacement products where the investigators would give the study participants specific foods, fresh foods, or different personal care products, so different cosmetics, different makeup products. And there were also some intervention studies that involved educational programs. So sometimes interactive, sometimes coaching, sometimes simple guidelines about things that can be done to reduce exposures to various EDCs. And most of these studies were done in women around, not some pregnant women, but also just women of all ages, and some in families and some in students and teenagers. And the interventions were very short to many months. And they involved case crossover study designs where the same people would do something for a period and their urine or different measurements would be taken and then do something else for a period, or randomized control trials where different groups would do different things. And these intervention studies looked at bisphenols, phenols, phthalates, parabens, persistent organic pollutants, some shorter half-life pesticides, and some chemicals in sunscreen. And most looked at urine levels pre and post intervention. And the next group of intervention studies involved residential or things being done in the home. And there are not as many of these studies, there's a handful, and some involve looking at the indoor dust levels or the urinary levels after a renovation with healthier, so-called healthier products, but products that have less plastic in the flooring or different chemical composition of the textiles of curtains or couches. And then other groups of intervention studies have looked at how the frequency of hand washing and cleaning the home, mopping or dusting affects the indoor dust levels and the urinary levels of various chemicals, including the PFAS, flame retardants, and phthalates, things in plastic, and also volatile organic compounds. And then the last group of intervention studies were focused on healthcare settings. So a lot of plastic is used in healthcare. If we talk about plastic, for instance, in tubing, up to 30 to 40% of the weight of the tubing used can be made of phthalates, composed of phthalates. And these studies have mostly been conducted in higher income countries, 6 in the EU, but usually they focused on DEHP, sometimes on parabens for their antimicrobial activity, so using fewer parabens or different types of parabens, and switching out BPA for another softener. So these were mostly changing the composition of the plastic products being used in healthcare. And sometimes it was for different processes involved in dental healthcare, dialysis, or blood transfusion. And some of these products were interventions were natural experiments where they looked at the levels in patients' salivary, urine, or blood levels prior and after a product was changed. And I should note that in the EU, there is no specific migration limits. There's no legislation on migration limits for substances coming out of medical devices, unlike for food packaging. There is an overall chemical safety or safety assessment for products, but not for what sort of chemicals, what the limits are for chemicals coming out of and leaching out of these products. So if we summarize all of the studies, and if you want more details, please look in our report for all these different studies. But we found that we made a summary of the weight of the evidence. So how many studies are there if we consider the knowledge and the data and the quality of the studies? We did not summarize how effective, what the magnitude of change was. So there's a little bit too little data to make really strong conclusions about what the biggest change will be and to generalize that across different countries. But we can say that some have been shown quite robustly to make a change. So there's a lot of data supporting that this is effective if you use eco-labeled personal care products. And there's been some studies looking into how consumers trust different labels and how effective they are, how readable or understandable they are. There's quite a lot of evidence for reducing your consumption of canned food leads to lower levels of EDCs in your body, to avoiding using plastic food containers, especially reheating in plastic food containers, limiting fish intake, notably the predatory fish or higher trophic level fish, and to clean more frequently, dusting and mopping. And also in the healthcare settings, there is growing evidence that changing the composition of the products definitely leads to a reduction in the body. Although I should say a limitation to these studies is that these intervention studies in healthcare settings looked at one compound, DHP or BPA, and not on the chemical burden or what else was coming out of these into the bodies. So less of a summary measure of the chemical burden coming out of these. So next I'd like to talk about what people think about EDCs, what do they know about them? And we did a survey in the Netherlands last year. We did a survey of a representative group of people, so of reproductive age. So we recruited people from different regions of the Netherlands, from different socioeconomic positions, and a distribution of female to male that's approximately representative of the Netherlands. And it was about 500 people. And then we recruited people, or people agreed to participate in our survey from a fertility patient organization. So it's an NGO that works with clinicians and public and patients who would like more information about fertility issues. And we see that in the Netherlands, 56% of people have ever heard of endocrine disrupting compounds. nearly all of the fertility of the people associated with the fertility organization had, but about half of the public had. So there's a large discrepancy there. There was also a difference in the composition and surely the motivation for people to be aware of this issue. And those with fertility issues are more concerned about their exposure to chemical pollutants. And this is what we see in this figure here. Then when we asked people, what do you do in your life? Then we also saw a difference in how the fertility participants versus the public behave. So people associated with fertility organization purchase more organic fruits and vegetables. They buy personal care products that are labeled as, for instance, paraben-free. They don't use plastic when they're reheating their food, or they do that less frequently. And they use cleaning products with eco-labels more frequently. We see also that the intention of the whole group, 89% are willing to act to reduce EDC exposures, and 95%, so nearly all, agreed it's important to do so. So this is, this is 500 adults of reproductive age in the Netherlands, and nearly all are agreeing that it's important to reduce their exposures to EDCs. So what were the factors that drove their willingness to make changes to their behavior and their actual behavior? We looked at this, and the biggest drivers were the perceived susceptibility. So what is the risk to me or to a potential unborn child? And the perceived barriers. So what would prevent it? What would make it less attractive for me to make changes? And also positive attitude, how they feel about making changes to the behavior, and the norms or the social pressures that they might experience. I'd also like to say that not the perceived benefits was not one of the biggest drivers, at least statistically, but it was interesting that 90% agreed that their health would benefit, or their child's health would benefit from reducing their exposure to EDCs. So these important drivers, the susceptibility and the barriers, we see big differences in how the fertility and the public groups perceive the risk of EDCs. So we measured this in various ways, but just to summarize, in general, the fertility group is worried that the risk is higher and they're more susceptible. And then both groups reported that an unborn child is much more susceptible to the risks than an adult. And with respect to barriers, high costs or worrying that alternatives are expensive was a barrier. And this is for both groups combined here. Other things that were noted is, I find it hard to reduce chemical pollutants. I don't know how, and a lack of control. So these are factors related to self-efficacy. Do people know do they have the knowledge and the skills to know how do they feel about their ability to make changes to their own exposures? I do not have time. That was not an important factor. And with less chemicals, my life is less comfortable is not an important factor. So the biggest ones were, concerns about higher costs and not knowing how to do that efficiently. When it comes to where people want to get information about how to reduce their EDCs, 70% want more information. Most of them want it around the period of pregnancy, many also before then. And their preferred source of information is the government or public health organizations, also their healthcare professional. And then some, around 20%, mentioned school. So that's a lower proportion. And very few want it from social media, although that was reported to be their primary source of information, was media or social media currently. Around half feel that they have some control over their exposure, so they can do something about their exposure. And nearly all or most think that the government plays an important role in ensuring that they're not exposed to too many EDCs. And 55% think the government's not doing a good enough job in the Netherlands. So if we compare this just to surveys that have been conducted across the world, then our results are broadly in line with those. There's been surveys in various higher income countries, mostly among adults and women around reproductive age. And these are mixed method studies where there's questionnaires and also focus groups and interviews. But to broadly draw conclusions across these studies, many feel moderately concerned, so not highly concerned, but they do feel concerned and insufficiently informed about EDCs, although there is a large variability across countries. And most report obtaining their information about EDCs from internet and media. But most would prefer to obtain information from health professionals, which they view as a trustworthy source, and that the government be responsible for ensuring that they're exposed to lower levels of EDCs. So we see real discrepancy from where people are getting their information and where they would like to be getting it. And how we might explain this, if we look at studies of surveys of health professionals, there's been a couple studies, then we consistently see across countries that health professionals report receiving very little training, or less than 10% reported receiving training in environmental health issues, including EDCs, and less than 20% routinely take an environmental history. And this is a broader one, maybe addressing also mold in the home, or many issues, but few do that and few have been taught how to do that. And FIGO has a preconception checklist. So the International Federation for OB-GYNs, Gynecology and Obstetrics. And they include one question about, do you think you're exposed to any toxic environmental chemicals? Yes, no, don't know. And if you have replied yes, you should be given specific advice on how to avoid reduced exposure. But I think that advice is missing somewhat. And so health professionals, when they report barriers to why they're not advising their patients, they report a lack of knowledge. Around 80% across several of these surveys report having insufficient knowledge on how to advise, counsel their patients about EDC exposures. They also report that there's uncertainty, and should we act if there's uncertainty, doubt about individuals' agency or their ability to reduce their exposures, and concern about increasing patients' anxiety. So I wanted to highlight a very nice example of a series of guidelines published by the French National College of Midwives. And here they have a series of articles, but they're advising healthcare practitioners how they can counsel patients during the preconception and during pregnancy on reducing their exposures by household sources and via personal care products and cosmetics. So to wrap up with our recommendations, we have 4 major recommendations. One would be to improve environmental health literacy and awareness of EDC. We highlight that the preconception, so before people getting pregnant, is also very important, as many chemical classes have longer half-lives. They're in our bodies longer. We see some nice examples of the effectiveness of eco-labels or labeling that give consumers some information on as to what might be a better choice. And we see in some countries there are apps that consumers can use to scan products, the barcode, for instance, and find out more about what's in a product or what might be a good choice. And there are some studies showing that giving people insight into their own exposures, and this is something maybe in the future when we have lower cost exposomics profiling, that is related to increased feeling of self-efficacy. I can do something about my exposures and increased changes in behavior, but this is an emerging area of research. And there are several studies showing there's efficient ways to have increasing environmental health literacy, and secondary school curriculum is one that's been highlighted in several countries as being an effective way to broadly address subjects like climate change and also pollution and EDCs. So we also call for increased environmental health training for health professionals. Many want it, few receive sufficient training or any training, and this could be through core and continuing education. There's few studies showing that online modules can be efficient, and also still that information is retained 6 months and a year later. And we put forward that FIGO could take a leading role for setting standards in this. A third recommendation is that we need more data. We have enough data to act already, but we think more knowledge on the effectiveness of interventions and promotion strategies would be helpful. So there's a growing body of knowledge on determinants of exposure, what influences what is in our body, but less knowledge on what works when we communicate to people what they can do. In addition to legislation, what they themselves can do, there's not very much data on that. So what influences accessibility and how people feel or approve of different suggestions. And there's very few studies looking at multiple chemical classes. A lot of the interventions so far are, yes, well, rather limited in how long they follow up people and focus on one chemical class and not sort of a broader series of recommendations and how that would affect multiple chemical classes. And lastly, we would support the development and implementation of current legislation to reduce EDC use and exposure. And we highlight the EU Chemicals Strategy for Sustainability, and their part of the mandate is to protect vulnerable groups. That would include also people that are going to become pregnant or want to become pregnant. And we want to ensure that regulations, that sufficient data is generated to identify EDCs. So I'd like to thank you. If you'd like to read more, please refer to our report, which is available online. Thank you.
Great. Thank you so much, Virissa. And that's a really great summary, like you said, of this report and this survey that you did. And very interesting to see how, you know, this cross-section of society that you studied in the Netherlands, sort of their different levels of concern about EDCs and how that affects different types of behaviors and what they perceive their level of control is and what they can actually do about reducing or avoiding altogether their exposure. So now we've reached the end of our two presentations, and we have our speakers on hand for a few questions, which I've been monitoring. And we have several of those, which I'm happy to share with you now. So I will pose the question, and then each speaker can decide if they want to take it. So one of the first questions is, are there EDCs that we, for example, should prioritize if we're trying, I'm assuming it means when we're trying to reduce exposure, or in terms of regulation, because they're more potent than others? So are there EDCs that we need to prioritize because they're more potent than others?
Well, I'll give it a go. So that's a very interesting and difficult question. I think what we have focused on in this study is actually broader than EDC. It's a general exposure to chemicals, I would say. So we haven't really specifically looked at what chemicals are more damaging or health hazardous than others. Of course, there are several chemicals that are on the substance of very high concern list. There are chemicals that are prioritized also for identification and priority setting. So if you would like me to pick one, I couldn't do it, I guess. So I think the whole concept of getting rid of endocrine disrupting chemicals, I think that's an important focus, and that's still not implemented well enough in regulatory safety assessment, I think. So yeah.
Okay. And maybe I could link this to a question that was posed just before, because Virissa, you mentioned in your presentation that the fact that, so this person says in reference to your presentation, the fact that avoiding canned food has a big impact means that, does this mean that BPA is more endocrine disrupting than other chemicals? Or is it that the cans leach huge amounts of the BPA into the food?
Maybe both. I mean, I should note that the EU recently proposed to ban BPA specifically from food contact materials, and this needs to be rubber stamped, but this will be presumably implemented in EU, which is a positive thing. So there is a lot of evidence for BPA of it being an endocrine disruptor. So we worry about that. We also worry about the replacements and the substitutes that have similar chemical formulation, do similar things in your body. So I guess both. We know that for certain foods, like acidic foods, that a tomato in a can, for instance, there's a lot of leaching happening. A lot of the BPA is coming into the food. And we do also know that BPA is an active EDC. So But how that would compare to maybe microwaving your food in a soft plastic container that's very disposable, I don't know that off the top of my head.
Okay. Another question that someone brought up was regarding this concept of self-efficacy that you tried to test for. Do you have any ideas as to how you can explain why self-efficacy was not a significant predictor of an intention to act, given that in the survey people said that it was that the difficulty is a barrier for them, so time or cost?
Yeah, that's a good question. If that was a matter of statistical power, or maybe it could also be that everyone was sort of in the middle and didn't feel they had a lot of control. And so if we don't have, this is maybe a bit of an annoying statistical answer, but if there's not a lot of people reporting a low amount of and a very high amount of self-efficacy, we also have less ability to tease that out. So there was more, I think, less variability in that variable compared to the other ones. Yeah, that it would have maybe expected it to be an important predictor, how people feel if they have control, but yeah, the barriers were more important predictor of whether people were making changes. Yeah, and their worries about it, so how worried they are about their susceptibilities and how big, whatever risk it is for them or their loved one's health or their potential. So I don't have a great answer there, except I think it might be a bit statistics, but maybe also a bit of reality that the other barriers are more important.
Maybe we have some statistics buffs online with us today. So I have a question here. I think maybe that's more directed at you, Majorie, but it could be for both. Have you seen a link made between, in scientific studies made between PCOS, so polycystic ovarian syndrome incidence, and chemical exposures?
Yes, there are studies showing that women who have PCOS have higher levels of chemicals in their blood, for some specific chemicals, than women without PCOS. Though it's always difficult to determine if the chemicals are really causing that disease then in these types of studies. Given that it's a disbalance in the hormones, there are definitely also reasons from toxicological or biological perspective to assume that EDCs are contributing to the onset of the disease or the progression of the disease. So yes, there are studies looking into that, but really saying that these EDCs cause PCOS, that cannot be told from those kind of studies.
Okay. And I just have a question then for both of you. What would you say are the largest knowledge gaps that remain in this field?
This field as in female reproduction or EDCs or?
Sorry, yeah, I'm not being specific enough.
Okay.
I assume it means the field of studying the impact of EDCs just beyond female reproduction, because like you said, Majorie, we're also now working on a sort of future project which is looking at impact on health in general at different critical stages in life, so not just female or male reproduction, but throughout the lifespan.
So critical gaps. Well, I think, I started also saying that there's still limited information on female reproduction. I think that holds true for a lot of diseases and disorders, just because we've just begun to understand that early life exposure causing later in life effects and how that exactly works, and now even multiple generations. So I think that's definitely something that's still understudied and underestimated when it comes to chemical assessment, looking at hormone disruption. So that would be my scientific EDC answer.
And Virissa?
Yeah, from the health promotion standpoint, I think I noticed in the literature and from the surveys, there's a sort of tension of there's uncertainty about some of the data, but we also argue for a precautionary approach also from the EU perspective on EDC. So I think from the precautionary principle perspective, we might not have all the data to know all of that we'd like to know, but we know enough to say it's worthwhile to reduce exposures to EDCs, and we know a lot about how we can do that, but we don't know how we can make that usable for people. So that last link about what pamphlet might not be enough. Who will find this pamphlet? So I think we need more effective ways or apps. I'm excited about this, but is this accessible to all populations? Are people finding this? So more of the structural environmental health literacy in secondary schools or in routine counseling. I'm excited about that and think more should be done to figure out what works there for people.
Okay. And I think
I'll add to that
sure.
No, also what came out of the study on the health professionals is that people are often scared they want to avoid scaring people about informing them of the hazards or the health effects that chemicals may have. And I think we should be mindful of that, but not, there are also very good examples on how you can create awareness and inform people about the hazards of chemicals and that we should not shy away from it.
Yeah. Yeah, sort of like the right balance between risk communication and really, I guess, empowering people with the knowledge that they feel they can act with. Probably the last question for today, even though we have a few more, but we will have to wrap it up. One of our attendees, they mentioned, as an advocate on these issues, I'm often asked, but how much of infertility or another issue is because of EDCs? Are we getting closer to knowing the answer in one location, perhaps?
Yeah, I think that's the million-dollar question. I know many reports have focused on that and studies also on means if we can put a number on it, it would also be easier to get people active to act on it, I guess. So there have been studies on the cost of inaction. Juliana mentioned that already in the introduction. Estimates range from 1% to 40%, which is, I think, the best case and the worst case scenario, maybe. So how much of infertility is due to endocrine disrupting chemicals? I couldn't put a number on it. Really, it's I think it's an important contributing factor, but definitely there are also other factors that contribute to fertility issues. I wouldn't dare put a number on it, but like I said, usually it's about between 1% and 40%, which is of course quite a stretch.
Yeah, quite a bit to work with still. Well, I'm conscious of the time, so I think I'm going to wrap it up here. Thank you to everyone who joined us today. Thank you very much to both our speakers, Majorie and Virissa, for all the resources you shared. Like they both encouraged you, we also ask you to feel free to visit the website for the FREIA project and as well as HEAL on our project section so that you can look at some of these resources in more detail, like the report and the FREIA project overview brochure and some of the policy briefs they developed under the Orion cluster. And we'll be sharing the recording in the coming week, as well as the materials associated, like the slides. And we thank you again for joining us this afternoon and for sharing this past hour of your insightful presentations and discussion. Thank you very much.
Thank you.